Welcome to Clap Back with the Facts podcast, where we are providing you with the information you need to know about what's politically impacting Black women across the country. In a world filled with mis and disinformation, we provide you with the real. If you're a Black woman, representing Black women, or in the community with Black women, we are here to clap back and give you the facts. Thank you for joining our Intern Special, Labor Pains, the Black Maternal Health Crisis. We will be sharing the facts and dropping gems, so let's get ready to clap back at the facts.
Hello, and happy summer. You know, we have taken a little bit of a summer break, and no, the break is not over, but we had to come back to give you this important special. This is our intern special. Yes, y'all, we done leveled up. We got interns in the house. And today our intern has put together a thoughtful and provoking conversation, labor pains and the maternal health crisis. As you know, we have Black women going through the things, and under this administration and with the revocation of Roe, we have seen our treatment of our health care for women go down. Well, I'm not going to lead the show. Y'all welcome our intern for 2025, Caitlin Flowers. Hey, Caitlin.
Hi everyone. My name is Caitlin Flowers. I am an intern with Sisters Lead, Sisters Vote, and I am so excited to be here. My topic for the day is Black women in maternal health. I feel like this is an extreme issue in our community, especially highlighting the recent events that Black women have gone through in these past few months. My particular case I wanted to shed light on is Miss Adriana Smith.
Wait. Hold up. I know you're excited, girl. But we got one more sister we got to bring in. If we don't bring her in, see, she's the one that comes with the analogies to break it down for the people.
Yes, ma'am.
So we got to have Miss Chantel Mullen. See, the people gonna be asking me, where's Chantel at? Where's Chantel at? How you doing out of that? Okay. Now we are ready. Now tell us what we doing. What was the case?
Okay, so the case was Miss Adriana Smith. She was a 30-year-old nurse and mother who suffered from a medical emergency and was declared brain dead in February. So she passed away, unfortunately, and her doctors kept the organs functioning to keep the fetus alive. This was against the family's wishes, and due to the Georgia's abortion laws, Georgia prohibits most abortions after 6 weeks. So the mother really had no choice. The family didn't have a choice. And I personally feel that that's inhumane. And I also personally feel like this is what's happening to Black women. Black women are the test subjects. We're the ones that they use that they feel are disposable. And I don't appreciate that, which is why I wanted to shed light on Adriana's story.
Well, you know, we got the Georgia Peach Extraordinaire on the phone.
Yeah, I'm here. You know, this, and I really agree with you. Thank you for our young folks lifting up such a powerful issue. And what's really interesting is I'm sitting in a space where you can't see it. Right over next to me is a whole box that talks about Black maternal beliefs. And so this has been an issue, a long-standing issue in our community, because our maternal health rates are poor. Our maternal outcomes are poor. And so this case was one that I watched with interest because I am from Georgia. And what I saw, we knew that there was going to be some trauma and drama after they passed that new law. But what we really saw was people pointing the fingers, saying, well, it's not really the law, it's this. Well, it's not really this, it's this. And so in there was lost that there was a young mother who had actually gone to the hospital. She sought treatment, was sent home, and then had a terrible outcome, which left her brain dead. They put her in the hospital, they put her on the ventilator. They basically kept her body functioning, and the fetus was very young, and so her body, this fetus was growing in a decaying body. And they don't like to talk about that, but that's what was happening, because it's not as if she were alive. She had actually passed. There's a difference between a person who is in a coma and the body that a person who has died, and keeping those bodies functioning, because they had to regulate all of that body's functions, which means there was a lot of medication being pumped into that body, a lot of monitoring. And so there was a fetus growing in all of that. And it got to the point where they had to, and we have to be mindful of the language, because they were saying, oh, they had a cesarean. They did not have a cesarean. They basically cut the fetus out of her body. And so it's not something she chose because she was not here. It's not something her family even chose and was able to consent to. So they were getting the runaround. We've not heard a whole lot about what has happened, but I believe the last that I read regarding what happened after the baby was removed from the body is the baby's having a lot of health challenges, And so, I just say, take a moment, say a prayer for this family, because they've had a lot of losses. They've had them, they had to deal with a lingering, because she had passed, and they had to sit there and watch her every day. And now they have a child that they are trying to take care of with some extraordinary health concerns. And they didn't even get the dignity of being able to make the decision around what happened with their loved one. And that's a crime in and of itself. That is terrible in and of itself, and it is inhumane, and it is unchristian. That family should have been able to make the decision.
Absolutely. And I want to make sure, this is usually the role that Chantel plays, but I'll dust off my law degree for this. I want to make sure that we also understand exactly what the law says, because there are actually multiple tragedies in this story. The basis of it being the Life Act, which was passed in Georgia's legislature in 2019. The idea is also known as the heartbeat law. And the idea is that the law prohibits abortion after a fetal heartbeat is detectable, which is normally around 6 weeks. Now, anybody who knows anything about pregnancy knows that at 6 weeks, we're just talking about a little nugget. It's barely detectable on a sonogram. Interestingly enough, after this case, a Fulton County judge declared that first and foremost, there was a lot of controversy over whether or not the law allowed the hospital the authority to require the parents, the loved ones of the woman, to be kept on life support. And it has actually been deemed unconstitutional. And in particular, a Fulton County judge declared that the law allowing abortions up to 22 weeks. And so there's also been a lot of misinterpretation of the law. And the part about keeping her alive was one of the things, because the law doesn't speak to the condition of the mother. It only speaks to the condition of the fetus. So you got bad legislation. You got people who are not legally trained making these choices, and possibly making them in violation of the law and the law's intent, even though it is still a bad law. But most importantly, you rob the family and loved ones of choice. And so I just think it's important for us to know, listen, and no shade, well, maybe a little shade to the Georgia legislators, but many of them are not medical professionals. So they're making these choices, and maybe they're not even the most informed choices. And Lord knows now, when you now compound that with the rollbacks, thanks to the legislation passed and signed by the president, that is rolling back Medicaid, that's rolling back support programs. I just don't know that this is, they talk about life at the beginning, but we need cradle to the grave support for us, because people, if we're going to be declaring people, we need to be serving people and protecting people.
Yes, ma'am. I definitely agree with both of you. I think that you both made very great points. And I wanted to ask you all both a question. So, as a young Black woman, I kind of fear going to the doctor, and I say that because I feel like I'm kind of rushed out when I go in. I'm telling them what's wrong with me, and then they kind of just give me a medicine and they send me out. So I wanted to ask you all, I know that my generation is very passionate about themselves and taking care of their health, because we do realize that our health is important. And I wanted to ask you all, how do you all think women in my generation should go about taking care of themselves and making sure they get what they need, especially when giving birth or having children, when we are being faced with women being used as incubators only because they were just turned away and ignored? So how do you all think women in my generation can have faith in healthcare and taking care of ourselves going forward?
Well, let me start with this. I think you have to really know, you have to be comfortable or get comfortable having a lot of key conversations and asking a lot of questions. And I think if you're not the most comfortable with that, because, sometimes people feel intimidated by doctors because they don't always understand all the words that they're using and that kind of thing. And you are kind of in a system, and even not understanding the rules of the system itself can be intimidating. So the National Medical Association actually puts out a list of patients' bills of rights. And I believe that, and it's specifically designed for Black people. And I believe they have one that's tailored to Black women too. So I absolutely encourage you to start by carrying that around when you go to the doctor. Here's some key things that I would do before you go. Understand the length of the appointment. Ask them, how long is this appointment expected? Many times the appointments may be scheduled for as few as 15 minutes to as long as 30 minutes, so that you know going in the door how much time you can expect to spend with the doctor based on how it is scheduled. Another thing to ask is, and then be clear about what you need to accomplish, because they may need to schedule you more time. If you are going in and you have multiple questions about different types of diagnosis, you might need a little bit more conversation time. And the best time to ask for that is before you go, not when you're sitting in the office.
Right. Okay.
So be real. So go in. So first ask questions about how long, what are the doctors or their office's expectation about how much time they're going to have with them, so that you are aware. And if you think you need more time, basically discuss it with them and tell them, listen, I have multiple things that I need to speak to the doctor about, this, and this. And I think I'm going to need just a little bit more time. You may have to reschedule it for a time when they have more space available, but at least you all go in on the same page about what's going to happen during that visit. The second thing, which is always good practice, and by the way, these are good for not just young women, but all women. The second thing I do during the visit, take somebody with you. especially if you're discussing something complicated or something that might be traumatic to hear about. We can get lost in one part of what the conversation is and miss a whole nother thing. And then the final thing, as far as the visit itself, make sure that you request access to your records after. And then once you leave, make sure that you read through those records and any doctor's notes that have been made, so that you are aware of what they're saying about you. And if there are any corrections that need to be made, that you have an opportunity to do that as soon as it happens. I can tell you, also, having practiced personal injury law, clients of mine have pulled records from back, during their pregnancy or during other crises, and found out the doctors have made little snide comments about how they were feeling. They have made snap judgments about what was going on with them. I've seen records where women have gone in and been very upset, and doctors notes them as being hysterical and out of control, when in fact, maybe they're just upset because something really tragic is happening, that has been really painful for them. And those are the kind of things that start to mischaracterize what's going on and lead them to not believe that, our hurt is real. So that's where I would start.
What I would add to that, Holly mentioned take someone with you. I encourage people to get a health notebook, because particularly when you're going to a lot of visits, doctors will ask you questions, and you think your doctors have access to all of your record, and sometimes you figure out that they don't. I had the same set of doctors for a long period of time. And every year they would say, well, who's your primary and who's your this? I'd have tests over here. And it took me a really long time to figure out that the doctor over here wasn't getting the records from the doctor over here. And it wasn't intentional. It wasn't intentional. It just wasn't happening. The systems weren't connecting. It wasn't doing all of the things. So, make sure all of your systems that should be working are working, but document, because sometimes doctors will tell you something or ask you something, and you have to go back and say, well, no, this is what you said. This is what we agreed to. You have to hold them to account as well. The other thing I would add is trust your gut. There are doctors. They are more doctors. If you go to a visit and you feel like you are being dismissed, address it. If it is not resolved, find a new healthcare professional to service you. Yep. And they may come in all shapes, sizes, and colors. I've gone to a Black male doctor, and I felt he was not hearing my concerns. So I left. And when I went to a Black female doctor and told her the same concerns, she was like, well, I don't know why he had you doing that. Because I was like, I was showing him, like, I'm taking this medicine, I'm getting scarring, I'm having reactions. And he just kept saying, kept taking it. And she was like, no, you should have been doing something else. And so doctors don't always agree. Know that they are people and they are making their best judgment, but they also come with biases. And so if you feel like that, ask, change, figure out what's going on. I had a doctor that was randomly assigned to me, because what will happen is, like, if you change insurance, they will randomly assign a doctor to you sometimes through your health, depending on your healthcare plan. But I met the doctor and was like, oh, I really like him. He was good, but I could tell you that I was probably in his care for about 10 years. Halfway through there, something changed. And what changed is he adopted a Black daughter. My level of care increased. He was already good. I mean, but he would come in, I'd come in and he'd say, "Do you know Black women had da 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 da?" I was like, "Oh," he'd be like, "No. Do you know? Do you know?" Because suddenly Black women were a higher priority. I mean, he was a good doctor, but he was a better doctor for me after that because he literally started looking up stuff and would tell me different stuff when I went to my medical visits. So it doesn't mean that you have to have a doctor who looks like you,
Right.
but that may be one of your considerations. You just have to think through what you really need. And sometimes you've got to be an advocate for yourself. Some doctors are great advocates, but you've got to have an advocate. And sometimes you may have to take an advocate with you because somebody else may be seeing something you are not seeing.
Yes, ma'am. Mm-hmm.
And so, you only get, this is all we got.
Right.
And I mean, you really do have to advocate for yourself. And it shouldn't take an instance like this where I went to the emergency room because I hurt my foot. And, the doctor walked in, kind of looked at me and said, "Oh, well, I think, I think you just might have hit it. It maybe bruised it." I was like, "No, my foot is really, really hurting." He looked at the chart and he said, "Now, what do you do?" I said, "I'm a lawyer and I work at a personal injury firm." He said, "Let me get you an x-ray."
Mm.
And what it turned out, I had actually chipped the bone in my foot. But you shouldn't have to get a level of care because somebody looks at your chart and says, "Oh, they're a lawyer, they may sue me."
Right. Right. Yes, I definitely love the points you all made again, because I think that it's really, and both of you brought up a very good point of making sure that you advocate for yourself, because I just got out of the doctor's office where I have the same issue. I have had the same issue for over a year at this point, and they have sent me to 3 different doctors, and the solution was not dealt with properly until I got assigned a Black woman doctor and actually a Black woman assistant who helped her out with my issue. So I made sure I told her, I said, "You actually changed my life," because the issue was just so painful, and it bothered me every single day, to the point where I had to continue going to the doctor, and I was being told, "Oh, well, nothing's wrong with," well, I'll just tell you, something was wrong with my ear, and they kept saying nothing was wrong with your ear. We don't find anything wrong. We ran all the tests, nothing was going on, and all it took was one visit, which she wasn't even my primary care, one visit from her to tell me that the real issue, which was something was going on with the tube in my ear. And to say that, I was just so shocked because I had gone through rounds and rounds of prescriptions and different medicines, and they just kept giving me the same thing. And I'm like, it's not working. My ear hurts. It literally hurts. And you are not listening to me. They sent me to all types of specialists, and they're telling me, "Okay, well, nothing is going on. Nothing's that serious." And I was just like, it shouldn't take me going through 3 different doctors to get the solution. And she finally prescribed me a medicine that was actually dealing with my situation. It was just allergies. It was literally just allergies and tube dysfunction, but allergies was the main issue. And I just needed stronger allergy medicine. And they kept telling me to take the basic kind, something that wasn't strong enough. And I was just like, "You're not listening to me when I speak."
But I want to interrupt you because you are talking about something that has been documented historically.
That's right.
Black women have complained about pain and have been under-prescribed or not prescribed the adequate types of medicine.
Mm-hmm.
Because, if you go back in history, there was this line of racial thinking that Black people don't feel pain the same way. that still impacts how people are trained. That
Yep.
still impacts how people prescribe medication and how they look at the symptoms of Black people.
Mhm.
I just want you to know you have presented a case a case study. I mean, literally, this is
Mhm.
what has been historically documented.
Mhm.
It's
Mhm.
it's really ridiculous, and that kind of brings me to my next point of access to healthcare, and even getting the opportunity to go and get that health care. So I wanted to bring up the child that was born of Adriana Smith, Chance, and I want to call him by his name because I feel like his name needs to be known to everybody. Chance was born and he was premature. He was 1 pound and 13 ounces. I mean, for you to take a life and take a life and force it to begin in a way that's so cruel to the mother. Now he has to grow up without a mother and with a family that is dealing with all these medical fees that, like, they didn't even want in the first place. And I just wanted to ask, well, not ask you all, but make the point of ask you all, yes, what systems should be in place or are in place for him to make sure that he has a life he can thrive in and receive proper care as he's growing up, because I'm sure that he's going to have different medical conditions, and just even if he didn't have any at all, who is there to provide for him? What systems are actually helping this child grow up and be taken care of? Because they want us to be incubators, they want us to have these children, but what systems are in place so this child can actually have a quality life?
Well, I'll tell you what, there were a lot more systems in place about 60 days ago than there are today. And I will say that when he was born, I think he was born in May or June, there were a lot more systems in place. And now many of those systems are being threatened. One of the key things is the CHIPS program, the Childhood Health Insurance Program, that covers children to ensure that children have access to health care. The people who are caring for them, even though it is referred to as the Women, Infant, and Children's Program, it is available to people regardless of their gender, for women, infant, and children to receive additional support. Part of that is also the SNAP program, which covers I can't remember what SNAP stands for, but it's the food safety program. All of those healthcare, assistance with food and shelter, assistance with care and support. Unfortunately, we have lost the child credit stuff. So the child care credit stuff. So that's no longer available. But those the food, the housing, and the insurance are available to a limited extent. So hopefully they're getting some of that support. But I will tell you, and as I understand it, they were fortunate enough to have family who's been interested in staying involved in Chance's life, to try to give him also the emotional and spiritual support that's necessary to raise a child. And I hope, but it's unfortunate that they may have to marshal some of their own resources as well. But essentially, those are some. And then I would say there may be some additional state support programs, although sadly, if he's still in Georgia, again, those may be in limited supply. I know if he were in a state, for instance, like Maryland, Maryland has a number of wraparound services, including things like counseling. We do have a state-based child care program. We do have the ability to get support with in-home services and some other things that come from our state supported funding for additional healthcare services. I don't know if they have that in Georgia.
Right. Yes.
There's a number of limited things, but we also have to look at, first, will the family be able to support him medically? That's he's a premature baby. But there are a lot of other potential challenges that could come with a baby being born so premature. There's also Medicaid, which we have seen that our country is cutting. But Medicaid not only provides services outside of the home, but Medicaid provides a lot of support to children who are in school. And so, there are a number of programs. At some point, if when he becomes school age, he may need some additional support services. And with the cuts that are being made in education, we are rapidly seeing a decline in our education budgets, and so schools are now grappling with the fact that there are a lot of cuts, and those cuts, are services, because children need services, and those services often look like people who are delivering those services. And so, I don't, I hope this family has a great support system, um, because the ones in the community are being decimated.
Mhm.
And I have always come from the perspective that the government shouldn't tell you to have or not have if you are not supporting.
Mm-hmm.
So if you're going to tell people that they have to have children, if X, Y, and Z happens, then you should be weighing in on the other side, because you are part of you have inserted yourself into the decision making process.
Yes, this is why we have child support laws. So if you about to be in on the decisions, you need to be in on the bills.
That
Yes,
part.
Mm-hmm.
I agree. And I also wanted to touch on the effects on mental health, because our physical health is undermined per usual. But what would having a child that you're forced to have really do to you? Having to stress, especially if you're in a low income or you don't have a job to support yourself or a family to support you, how would you get by? Like, I don't understand, how are people supposed to keep a positive mindset and continue getting up every single day knowing that their bodies are not valued by our government, are we're just looked at as people to keep having kids and not even be supported when we do have those kids. So my next question to you all is, how do we as Black women, especially Black women who are looking to have children and are ready to start a family, how do we continue keeping our mental health above all when it comes to taking care of our physical bodies and being undermined constantly? I know that this is very similar to my last question in terms of what we should do, but I guess
It's
my
different.
okay, yes, okay.
Go ahead, Chantel, because I know you have a daughter who's in social work, so you up close and personal with this.
Yeah, but I think I would just say that we could expand the question, because it's about value, period. We have a lot of systems in America that don't value Black women. There's medical treatment is just but one of those systems. But out in the workforce, where we've had over 300,000 Black women pushed out of the workforce, if you look at statistics of intimate partner value, violence, you will see a high rate of Black women being the recipient of that violence. You will see Black children being pushed out of schools, and Black girls at a high rate, particularly around suspensions. And so there are a number of systems. Self-care is very important. One of the things Holly and I have been talking about is therapy. You know, find the support system. It's important that you have a supportive network. It's important that you have not just good physical health care and providers, but that you have good and supportive mental health care providers. And I
Yep.
think one of the things that has happened as of late is more people are talking about therapy, about getting mental support, that we've taken a lot of the stigma away from it. So I'm going to be the first one to say, if you ain't got a therapist, go get you one.
I pray that the family raising this child have a large support network of family, of faith, and that it includes therapy. I cannot imagine losing a family member, a daughter, a sister, a wife, or a partner, and then having to raise a child under such extreme circumstances, having gone through such extreme circumstances. I mean, you would need so much support from, grief counseling to family counseling to even be and even being able to manage, the trauma, the ongoing trauma of raising Chase. So I think that there's definitely going to be a need for a lot of support in that area. I think, on the policy side of this, I'll say, under the Biden administration, we were really successful in expanding support for mental health services. We are seeing a lot of that be restricted now, and particularly in institutions. They no longer they're cutting the support for mental health professionals to be in schools, for instance. They're cutting programs and training for folks who deal with children to have access to certain types of training. We see what the Health and Human Services Secretary is doing with autism. And I'll just say overall, something that is going to really impact us in a major way, that is really fundamental to this conversation, but it's not something that we always think about. Probably one of the most damaging things that's starting to happen is the lack of data. This administration has made a critical decision to stop tracking things, to stop counting things, to stop disaggregating data along gender and racial lines. This is going to make it incredibly hard for us to be able to have accountability measures. It's going to make it hard for us to understand where we are falling short and how much and to what extent. It's going to make it difficult to show bias. We fought really hard, and frankly, we haven't had this kind of disaggregation of data for very long in the span of time. And so this rollback on how we are even recording information is going to be the thing that I think makes it even more difficult, even once we get past this administration. And I do believe this administration is a temporary thing. It's going to be hard for us to build systems back without having data and having a gap in data and having to rely on dated data, but old data to be able to try to make some of these decisions. I have to applaud states that are seeking to try to fill the gap. But again, it's only so many gaps that the states can fill when when their resources from the feds are also being cut.
Yes, and Holly, that is that's a major point. Data is being rolled back all across all fields. And as you were talking, I got a flashback, I guess a PTSD flashback to COVID, when we couldn't get adequate data and they didn't want to track data. And it
Mhm.
became, oh, it's just going to be okay. And that is one of the things that particularly um, as we are moving forward, and just to circle it around, the reason we know about the Black mortality rate, maternal mortality rate, is because of data. But if that is no longer there, you can just basically tell people you're making it up. It's all in your head. But when you have the numbers to support it, it becomes a different story. And you can push and advocate for different things because you know where and when and what. They're rolling us back to the Stone Ages in terms of data, because if you destroy the data, people don't know what's happening.
Right, it's
And
like,
it's any which way the wind blows. But basically, it becomes what you say. And that's unfortunate because a lot of people are going to suffer. A lot of people are going to have adverse legal and health outcomes because of this. And, we're just at the very beginning of this, but the impact of it will be long standing.
Yes, and to bring in the final point, I just wanted to remind everyone who's viewing the podcast to don't become desensitized. I feel like a lot of people are becoming desensitized to our reality, and they're kind of just looking at their phones and putting it down and not doing anything about it. I firmly believe that Black maternal health is not a policy issue. It's literally a life or death matter for our community. It's not a time to be looking at our screens and forgetting about what happened to Adriana. It's not the only time it's going to happen. They're going to try and do this again and again and again. It's not the only time. It's a warning. And I feel like it is very important that we bring attention to this matter. This is dystopian. This isn't what's supposed to be our lives. We are supposed to be here thriving and living. And I feel very passionately that the women in my generation and your generations are going to be able to come together and fight for our reality, because this is not what we want it to become. So I say all this say that we need to demand federal protections. We need to get out and talk to our representatives. We need to make sure that our reproductive rights are protected every single moment of time. We don't have time to be suffering anymore. It's time to speak out. It's time, because before you know it, you could become another statistic, and we don't have time for that. So that's all I have to say. I'm very to be on this podcast and get that point across, because it's very passionate for me. I want to thank you both for your time and your dedication to this matter, because I feel very passionate, like I said, and to bring attention to it is really going to change lives. Even if one person just opened their eyes to see that this is wrong, that one person can be the change maker. So thank you for your time. I really do appreciate both of you. And that's all I have for today.
All right, let's give it up for Caitlin. We are so excited to have had you be a part of our Clapback family. We'll have to have you back to talk about other issues. We have thank you for making sure that we had an amazing intern special. I know y'all are like, when are y'all coming back? We need to see y'all. Well, we still vacationing, okay? We need us a little break. This is self-care in the making. So you'll see us soon. But for now, toodles.
Peace.
Thank you for joining us here on Clapback Get the Facts podcast. We hope that you're leaving feeling more informed and ready to provide others with the facts. We would love to hear your biggest takeaways from this episode. So post the show on your Instagram story and tag us at Sisters Lead. Also, if you haven't already, don't forget to subscribe so you'll never miss an episode. And while you're at it, please leave a review so others can get some sense of the facts that we're providing. Finally, if you would like to learn more about local resources and other projects we're working on, go to sistersleadsistersvote.org.